When a woman comes into me and says, I have a vaginal prolapse, I take a look in, her bladder is hanging down and it's bothersome to her, I'll talk to her about different options. One of the main options she needs to know is that she doesn't have to do anything. There's no absolute emergency or urgency to do anything for this. The next choice would be to create a level of support just with her own tissue. The next choice, which I'm very excited about, is the biologic grafts. One of the biggest developments is a device called MatriStem. This has been cleared for use by the FDA for the past few years. It's from a company called A-Cell. A-Cell has been in the wound care market for quite some time and had some amazing results with healing wounds in people that they thought they could not heal. So people that have had really bad injuries can regrow tissue that should be where the wound is, the site-specific tissue. So it recreates their own tissues to be functional, have blood supply, nerve supply. If you have a scar, it's not the same as normal tissue. This regrows normal tissue. MatriStem is particularly exciting in women who have had mesh complications. When you've had problems with a mesh having to be removed or an erosion of mesh, in those women in particular, I'm using this graft to try and regenerate some site-specific tissue, hopefully getting them back to their more normal state, to allow them to have intercourse with at least diminished pain, maybe even normal function. The woman will come in, have general anesthesia. I will go in through the vaginal area, make an incision, create a level of support in the pelvis, and then close it up. When the woman wakes up, she looks exactly the same. No, there's no incisions on the outside. Everything is very minimally invasive. Usually people go home the same day. What women tend to notice after the procedure is they may have a little bit of pelvic discomfort, but generally speaking, within the first 2 weeks, they are doing well from a pain standpoint and are pretty much back to their normal functional activities, with the exception of holding off on intercourse for 6 weeks post-operatively and not lifting anything more than 10 pounds because we don't want to undo some of the healing repair. The MatriStem products have been used in over 170,000 patients in the past 5 years. Women are looking for safety and comfort, and safety and comfort are what the biologic grafts offer that the other vaginal meshes can't always guarantee. We're fortunate at Specialists in Urology to be one of the very few places in Florida that offer this at this point. This is not available at every urologist office or every gynecologist office. And we've seen some very good results, and we have a good deal of experience with this. It's very exciting in wound care, and if a patient were to look up A-Cell on the internet, they'd see some amazing examples. They're using this in children's burns, they're using it in really severe wounds that no one else can heal, and it's making some really miraculous improvements in patient care.